Hello, everyone. I'm Barbara Nickel. I'm president of the League of Women Voters, and I'm here with Gina, who's going to introduce herself now.
Hi, my name is Gina Trexler Souza. I'm the secretary for the League of Women Voters in the Mount Baldy area.
So I just want to say a couple of things about the League before we start with Gina's section of the pros and cons. And that is that the League of Women Voters never supports or opposes parties or candidates. We do, however, study issues, and we protect and defend democracy by using the courts sometimes, judicial systems, and at all levels of government. In order to know more about us, you might go to our website at lwvmountbaldyarea.org and look at all of the things we're working on. Okay, I'm going to share my screen now, and then Gina can start her talk.
Thank you, Barbara. So I'm going to get started today on Proposition 34, which deals with a pretty pressing issue for Californians, that's healthcare. Proposition 34 would restrict the spending of prescription drug revenues by certain healthcare providers. The question being asked is, should certain healthcare providers be required to spend 98% of revenues from a federal discount prescription drug program on direct patient care? And should the state be permanently authorized to negotiate Medi-Cal drug prices? The situation is that healthcare providers earn revenues from a federal drug discount program, and then they decide how to spend the income. Medi-Cal provides coverage to people with low income. What Prop 34 proposes is that we create new rules about how certain healthcare providers spend the money earned from the discount drug program, and it would allow the state to permanently negotiate Medi-Cal drug prices. The fiscal effects could be millions of dollars to identify and punish providers who violate the law. Those fines would likely be imposed on those providers. Supporters of the proposition say that Prop 34 will ensure money from the discounted drug program is used for direct patient health care, and that Prop 34 will make the discount program permanent. Opponents say that Prop 34 targets only one healthcare provider that supports rent control, and that federal law allows profits from drug discounts to support any nonprofit mission of healthcare providers. So to clarify, a yes vote on this measure would mean that certain healthcare entities would have to follow new rules about how they spend revenue that they earn from a federal drug discount program. Breaking these rules would result in penalties, for example, not being able to operate as a healthcare entity generally for a 10-year period. The financial support so far has been $30 million and has come primarily from the California Apartment Association, the California Association of Realtors, and the St. Anton Communities, which is a San Francisco-based apartment and mixed-use builder. Opponents to the proposition have raised just over $1 million, and they include the AIDS Healthcare Foundation, the National Organization for Women, and the Consumer Watchdog. Moving on to Proposition 35, it would provide permanent funding for Medi-Cal healthcare services. The question being asked is, should California make permanent an existing tax on managed healthcare plans to provide ongoing funding for Medi-Cal and other healthcare services? The situation is that California pays for part of its share of Medi-Cal through a temporary tax on managed care organizations, or MCOs. The proposal of Prop 35 is to make the existing temporary tax on MCOs permanent, and also to create new rules for how the tax money can be spent. The fiscal effects would be an increase of $2 to $5 billion per year to fund Medi-Cal and other health programs in the next few years. Additional costs to cover services are not included in Proposition 35. Supporters say that Prop 35 will support health services and improve access to doctors that help low-income people. While there was no formal argument submitted against Prop 35, some argue that it will limit the legislature's flexibility to make budgetary decisions and adjust their priorities based on changing needs. Governor Newsom has himself expressed this concern. Financial supporters have spent $48 million on this proposition. They include the California Hospitals Committee on Issues, the Global Medical Response Incorporated, and the California Medical Association. And now to close out with Proposition 36. Proposition 36 would allow felony charges and increase sentences for certain drug and theft crimes. As a little bit of background, in 2014, California voters approved Proposition 47, which classified certain crimes as misdemeanors instead of felonies, unless the defendant had prior convictions for murder, rape, certain sex offenses, or certain gun crimes. And it allowed resentencing for those currently serving a prison sentence for any of the offenses that the initiative reduced to misdemeanors. Prop 36 would undo some of Proposition 47's reduced sentencing. So the question is, should California allow people to be charged with felonies for possessing certain drugs and for thefts under $950 if the defendant has 2 prior drug or theft convictions? The situation is that ballot measure in 2014 turned nonviolent crimes like drug possession and shoplifting into misdemeanors unless someone has prior convictions for serious crimes. Prop 36 proposes that we turn some of those misdemeanors back into felonies, lengthen sentences, and require some sentences be served in prison. The fiscal effects would be increased state and local costs for prisons, jails, and mental health, and drug treatment likely between tens to hundreds of millions of dollars annually. Supporters say that Prop 36 would make communities safer by holding repeat thieves accountable and making thieves and drug dealers serve tougher sentences. Opponents say Prop 36 would make California less safe by stopping crime prevention and drug treatment programs. Prop 36 would cost taxpayers billions of dollars. Financial supporters have spent $11 million approximately in support of Prop 36. They include Walmart Incorporated, Target Corporation, and Home Depot USA. Financial opposition is at $2 million, and that includes Patricia Quillen, a philanthropist, Stacy Schusterman, a philanthropist, and the Service Employees International Union. Thank you.
There. Okay, I just want to sign off and say goodbye to everybody, and please vote. You probably, at this point, you probably have your ballot in the mail. So mail it in, wait, go to the polls, whatever, but please vote.